Not getting pregnant is a stress related disorder. Before you get angry for hearing me say that, let me prove it to you. Before we get into that, let me just remind you of something really important, which is that today is the very last day of the Super Fertility Summit. It is closing a few hours from now. The free access is closing a few hours from now at 3 p.m. Pacific. So it is now 10, almost 10 a.m. Pacific. So that means 5 hours from now, the free access is closing. And let me tell you something, it actually affects me in no way whatsoever whether you go in and use this resource or not. I've already created it for you. It's already done. I make no money off of you going in there because you get free access. So it really doesn't affect me one way or another, but I want you to have access to this so badly. I created it for you. And I created it for you because I knew it was something that you needed. And I know that in there, if you just take the time to go in there, you will find the answers to so many of the questions that keep you up at night. So many of the questions you feel like you have nowhere else to go to ask. So many of the questions you've tried asking your OBGYN or your reproductive endocrinologist, and didn't get an answer for. You couldn't ask those questions there. Your questions were dismissed, they weren't accepted. And I also know that inside the Super Fertility Summit, you will find answers to the questions you didn't even know that you should be asking. And that's exactly why I created it for you, because after almost 28 years, a month from now, or about 6 weeks from now, it'll be exactly 28 years of doing this work. I know the questions that you're asking, and I know the questions that are critical that you don't know to ask. And so I have asked and answered, with the help of 43 other experts, all of those questions in there for you. And like I said, it doesn't make a difference in my life if you go in there and utilize this resource or not, but I created it for you because I want you to have it. So I want you to go in there and use it and make the most out of it and let it change the course of your fertility and your reproductive health more broadly, and your family and your life. So don't miss out on this incredible opportunity, which is just right there at your fingertips, completely free, for just another 5 hours today. So you can go to fertilitypregnancy.org/class and grab this resource and just make the most out of it. Really dive in and get everything that you need there. Let me just share a couple of the incredible messages that we've been receiving about the Super Fertility Summit, and I'm eating them up. So keep them coming, please. Okay, so first of all, if you haven't heard, our Super Fertility Summit, your Super Fertility Summit, because it was made for you, was featured on CBS News in the morning, Saturday morning broadcast, which was absolutely incredible. And then all on the health segment, here are a couple of the messages. We really enjoyed your conversations with the different fertility specialists. Thank you. All the chats were absolutely amazing, so vulnerable and insightful. Thank you, Dr. Cleopatra. Thanks so much. The talks have been truly inspirational. Yay, it's amazing. I have renewed hope. Thank you so much. If you suffer from endometriosis, PCOS, hormonal issues, or have had recurrent miscarriages, or if you're planning to have babies in your 30s or 40s, whether by choice or due to circumstances, I highly recommend attending the Super Fertility Summit, which is online and completely free. I've worked with Dr. Cleopatra myself and used her Primester protocol, which focuses on epigenetics and fertility. I've just watched day 6 of the Fertility Summit, and it's packed with incredible resources, data, and information that could help you significantly if you're experiencing any of these circumstances. So these are just a couple of examples of the incredible messages and feedback that we've been receiving on the Super Fertility Summit. And I'm not surprised. I fully expected this because I of course sat through all of the interviews because I did all of the sessions with our experts, and they were just so incredible. They have been so incredible. So take advantage of that resource, fertilitypregnancy.org/class. All right. So let me tell you why not being able to get pregnant is a stress sensitive disorder. So we hear all the time people talking about how people say you should just, if you're not able to get pregnant, you should just relax. And it's really infuriating to a lot of people when people say this. And I completely understand that and agree with that. And it is true that fertility is highly psychological. And what I mean by this is that there are intricate feedback loops between your psychology and your fertility, and specifically your central nervous system and your hypothalamic pituitary adrenocortical axis, your HPA axis, which is also known as your body's stress response system. And the thyroid and the ovaries are on this axis as well. And we know that almost all of the reasons why someone doesn't get pregnant have a psychological and or affective meaning having to do with emotion, psychological and or affective component, usually involving stress, whether it's psychological stress, physiological stress, chemical stressors, environmental stressors, social stressors. So let me give you some data and examples of this so that you can see for yourself what I mean when I say that not being able to get pregnant is a stress sensitive disorder. Now, let me just reiterate here. When I say that not being able to get pregnant is a stress sensitive disorder, I am not saying that all you need to do is relax and that will solve the problem. I'm not saying that. I am also not saying that fertility challenges are in your head. Okay. I'm not saying either of those things. What I am saying is that almost all of the leading causes of fertility challenges have a stress sensitive component to them or are known to be exacerbated by psychological and or other types of stressors. So let's just break this down into two of the leading categories of a woman, and I'm going to focus on conditions in females. I'm not going to even bring in the conditions in males. And obviously, we know that males play a huge role in this, but let's talk about the female side. There are two overarching reasons why a woman can't get pregnant. Either it's age related fertility declines, or they are fertility or reproductive health conditions that are present at any age. In both of those cases, those overarching cases, stress is hugely at play. So let me give you examples. Let's talk about the age-related fertility conditions first. Okay, ovarian reserve. Sometimes people think of this as the number of eggs that they have left or how far they are from menopause. And also people can use as proxies for this their AMH level, their FSH level, their antral follicle count, how many eggs they were able to retrieve in an egg retrieval process, either for egg freezing or for IVF, or how many of those eggs fertilized in an IVF process, how many of those fertilized eggs progressed to the blastocyst stage, how many of those embryos tested as chromosomally normal, how many of those chromosomally normal embryos or embryos that weren't tested were successful in embryo transfer. That those are all indicators or used as indicators of ovarian reserve. So ovarian reserve and egg quality. And by the way, most of those are also used as indicators of egg quality. So those are two dimensions that are directly related to age. They are an issue in younger women, but they become more and more of an issue as women get beyond their 30s, 35 plus, 45 plus, etc. Okay. So there is clear scientific evidence that both ovarian reserve and egg quality are diminished by psychological and other types of stressors. So, not being able to get pregnant as a result of age related fertility challenges is on average stress related or exacerbated by stress. Now let's talk about reproductive health conditions that are the leading causes of infertility or fertility challenges across age groups. So this is not something that happens just because of age or even is disproportionately experienced in certain age groups, maybe with the exception of one of them, which I'll note for you. Okay, PCOS, endometriosis, fibroids, menstrual irregularities, including short luteal phase, having low progesterone, etc. All of these things also have at their root cause accelerated wear and tear on the reproductive system in the larger person or organism and are exacerbated by stress. Okay, so again, age-related fertility declines and broader reproductive conditions that are not specifically associated with age, but increase the risk of infertility or fertility challenges, almost all of them have as a root cause or as an exacerbating factor psychological stress and or other types of stressors. So the bottom line is that not being able to get pregnant and also in many cases not being able to stay pregnant, so experiencing pregnancy loss, these are stress related factors. These are stress related disorders. Why has no one ever told you this before? Well, if you're in our community at the Fertility and Pregnancy Institute, and especially if you're in the Primester protocol, you know this because you're blasting through every type of stress, fear you could think of, social comparison, shame, guilt. I mean, work stress, relationship stress, everything that you can think of, we are working on because we know how essential that's going to be to making your super baby and your fertility success more broadly. Now, outside of FPI and the Primester protocol, either it's not being talked about at all or we're only giving lip service to it. And here's why. Nobody knows how to deal with it. So if we do acknowledge that stress is at the core of these problems and these problems are becoming bigger and bigger, which means we have a bigger and bigger stress problem in our world, what are we going to do about it? We don't know how to manage our own individual stress, let alone help teach other people how to manage their stress, help reduce stress in society more broadly. And on top of that, let's think about it. So if the primary avenue for addressing fertility challenges is going to IVF, those of you who have been into a fertility clinic, a traditional fertility clinic where you're looking into doing a procedure such as IUI or IVF, you know that the doctors are there to help you. That's why they got into this in the first place. And their training did not include anything about your psychology, your emotions, and the stresses that you're coping with on a day-to-day basis related specifically to wanting a baby and not having one yet and broader. stresses. So they don't have the tools. This is not within their purview to adequately address this or to address it at all. And sometimes they're not even able to be particularly sensitive about it. In fact, when you hear negative reviews of certain clinics and or specific doctors within those clinics, a lot of the negative reviews will be focused not on whether the treatment was successful or not, but on the bedside manner of the doctor or of the staff in the clinic. And that's because that's what people remember. People remember how you made them feel. They remember if you made them feel loved and cared for, and if you made them feel like, I care about your success as much as you do. I always say to our mamas, because I mean it with all my heart, your super babies are the answer to your prayers, but they're also the answer to my prayers. And people remember that. They feel that. But if you're rushing, you're treating them like a number, you don't want to have, you want to talk about the intervention, but you don't want to hear anything about how they feel, what they've been through. You wish you could take that part out of the picture and just gloss over the human part of the person sitting in front of you so that you could treat their body parts, so that you can do this intervention and get them their baby, circumvent any problems, circumvent the stresses, and get them their baby. People remember that too. And there's actually scientific data to show that ratings of healthcare practitioners and other kinds of service delivery professionals are often dependent not upon the outcome, but upon the process and how you made them feel, how they felt when they were with you. And so if you're somebody who's been in a clinic and you remember feeling like a number and feeling like they weren't as invested in you, they're just going through the motions because that's what they do there, then you probably don't have a positive evaluation of that place or that doctor. But what I also want you to know is that their training didn't include any of this. So they don't know how to address these things. And that's why it's not being talked about there, because they can't address it. They can't treat it. In fact, if they could, they would extract that piece from the picture so that it wouldn't get in the way of their success. But we can't do that. The human part is always going to be there, and it's always going to affect whether someone's going to be successful. But nobody, almost nobody's talking about it. And then nobody but us is addressing it. So I want you to know, don't shy away from acknowledging that getting and or staying pregnant is going to require you to look honestly at the way you're living and who you're being in the world and in your life. And it's going to request and require of you to engage with the stresses of your life differently. And in some cases, that will mean taking those stresses out of your life to the extent that that's possible. And in other cases, that will mean changing the way that you respond to those stresses if you can't take them out of your life. But that is going to be a requirement, because problems getting and or staying pregnant are stress related disorders and diseases. And we have to be talking about that, because solutions that try to circumvent that truth will always fall short. And that's part of why just doing IUI or IVF without addressing the individual level modifiable factors inside of you and in the world around you, the changeable factors inside of you and the world around you, make it very unlikely that you'll be successful. Okay. So I know that it's easier to outsource the solution and say, here, I have this problem, fix it for me. Put me through this procedure and fix it. I don't want to do the work. I just want you to fix it. And trust me, there's nothing that the IVF and other practitioners would love more than to be able to just have you outsource it to them and fix it for you. But the thing is, that the variables that go into your success are also in, they're not just about the treatment or the intervention, they're also inside you. And in fact, those have an even larger effect in many cases than the intervention themselves. That's why so many interventions fail. That's why I always say you cannot outsource your healthy raw material. You cannot outsource your fertility and pregnancy pyramid. You cannot outsource making your super baby. You've got to primester, and only you can do that. I can't do it for you. I can show you the way to do it. I can give you the tools. I can support you so that if you're falling off, we help you get back on. But only you can do it. And it would be easier to have somebody do it. And like I said, from the perspective of the traditional fertility specialist, it would be easier if they could take it out of your hands and have it only be in their hands. But that's not how it works, unfortunately. So, fortunately or unfortunately, because the good news is you have a lot of power in your hands. So, just remember that. All right. So, just a reminder, problems getting and or staying pregnant are stress related disorders or diseases. That doesn't mean that I am saying to you that it's all in your head, because that's not true. And it also doesn't mean that I'm saying to you that you just need to relax and everything will be resolved and will be fine, because that's also not true. That being said, the primary root causes for problems getting pregnant and or staying pregnant have stress as their driving factor or as an exacerbating factor. Something like ovarian reserve, which people will tell you is just because of age, there's clear evidence that psychological distress accelerates the loss of diminished ovarian reserve, that having high adversity in childhood and adulthood contribute to greater likelihood of diminished ovarian reserve too early. So even something like that, egg quantity and egg quality have a psychological component and are driven by stress, both psychological stressors and other types of stressors. You know this because you know that environmental stressors and chemical stressors like plastics are harming fertility, pesticides, glyphosate, all these things. But these are stressors too. And yet, psychological stress is a huge part of this picture that keeps being overlooked. So I want you to be clear about that. All right. So today is the last day of our 7-day Super Fertility Summit. I can hardly believe that it's almost over. We worked on this event for 9 months, at least 9 months leading up. And I honestly, I'm loving it so much. I'm having the most amazing time with all of you that I wish it would never end. But I want you to get in there before 3 p.m. Pacific today, 6 p.m. Eastern, so that you can grab your free access before the free access closes. Go to fertilitypregnancy.org/class. Keep sending in your messages about your experiences with the Super Fertility Summit, because I'm loving those messages so much. We're eating them up, all of us at Team FPI. And also, let us know how you want to continue the summit experience post summit. So, how do you want to continue the learning? How do you want to continue the implementation? How do you want to continue the immersion? How do you want to continue the community? Send us your dream list, because we want to hear all the requests, all the requests. So dream big. It doesn't matter how big it is, dream big. Send in the requests. We will take all of them under consideration, and we will implement as many of them as we possibly can. Okay. Oh, and oh my gosh. So Mama Jasmine just said something really important, which I didn't even include. This is on Instagram in my example, which is unexplained infertility or unexplained fertility challenges. Same thing. So I had my list. I broke it down into two overarching explanations for infertility or fertility challenges, as we say, FPI. So, on the one hand, age related fertility declines, and on the other hand, broader reproductive disorders that are common across the reproductive lifespan and are not affected specifically by age, although one of them is, which I'll come back to. So I talked about, as examples of age-related fertility declines, ovarian reserve, which you can think of approximately as the number of eggs you have left. That's not exactly right, but that's how people often think of it. And then egg quality, which is the quality of the eggs that you have remaining. And of course, here I'm focusing on the female side, not the male side. And then I talked about, on the other side, broader reproductive conditions that are the primary drivers of infertility or fertility challenges. So PCOS, endometriosis, fibroids, and other kinds of menstrual irregularities. So, first, let me say that the risk of fibroids can increase with age. And there's a statistic that's somewhere between 70 and 80% of women will develop fibroids by the age of 50, which is completely mind blowing to me. So, don't think that just because you're older, and maybe you've been with the same partner for years or decades, that you don't still need your pap smears. You absolutely do, and your pelvic exams. Just public service announcement. Okay, so let's add to this unexplained infertility, because unexplained infertility is one of those ones that straddles the two overarching categories that I just mentioned. So unexplained infertility may become more common with age, but it's also present in earlier reproductive life as well. What it means is that there's no known physiological explanation or physical explanation for the inability to get and or stay pregnant. So there's no specific condition that accounts for it. Ovarian reserve looks fine. There's not there's not a measure of egg quality, but the assumption is that egg quality is okay when ovarian reserve looks fine. That may or may not be true, but that's how it's treated. There's no PCOS, there's no endometriosis, there are no fibroids, there's no pelvic disease, there are no infections, sexually transmitted infections. Oh, now Instagram's going to block my post when I publish this. Instagram, stop flagging my videos as inappropriate. I'm not teaching anything inappropriate. It keeps saying that I'm teaching about like sexual things, but we have to talk about sex when we talk about reproduction, right? Okay, so other kinds of menstrual irregularities, erratic cycles, irregular cycles, cycles that are very long, cycles that are very short. PCOS is often associated with very long cycles. As ovarian reserve becomes less and less, first the change will be that periods will become more frequent. That's one of the first signs of reproductive aging, is that the menstrual cycle will reduce by 1 to 2 days. So periods will become more frequent. But then as someone gets farther along into their reproductive aging and even closer to menopause, then periods will become farther apart, because what happens is that there are fewer and fewer and fewer periods each year until someone goes 12 months without having a period and is officially in menopause. Okay. So unexplained fertility challenges absolutely fall into this category. This category of psychologically driven or stress related disorders, and can be present more and more with older age, but are relevant at is relevant at younger ages as well. So I think that's very important. Let's see. Mama Jasmine's laughing about the fact that my videos keep getting flagged on Instagram as inappropriate and also on TikTok. And the thing that really gets me is that I think people really put inappropriate things on social media, and somehow like they do that, and then I'm over here like teaching about something critical we all should have been taught about in health class and in so many other places in our at our doctor's offices in the world. I'm teaching from data, scientific data, and I'm totally appropriate in how I'm talking about things and teaching them. And we have to keep, I mean, we always we challenge the decision and it always gets reversed, but it blocks our videos from getting seen during that period when it's been flagged and it's under review. So it's so frustrating. But anyways, you got to do what you were put in this world to do, no matter how the platforms respond, etc. Okay, hi everybody. So all right, so I'm gonna close down on the other channels, and then I'll spend a little time saying hello to the people who are live on Instagram. Thank you. I see somebody there on Facebook still. Thank you for being here. All right, so I'm gonna shut down, sending you off with warmest wishes and super baby dust. Don't forget to go to fertilitypregnancy.org/class to get into the last few hours free of the Super Fertility Summit. Can't wait for you to experience that.